So EHR usability, and this is something, when I was a CIO, also for 25 years in different places, as we were implementing the technology for what we all thought were the right reasons, doing as good as we could do and things like that, always, and I'm sure you got this pushback from clinicians, you hear, you're going to kill somebody, you're ruining my day, I'm burned out, I'm blaming the technology, and and I know that that's certainly a piece of it, right? I mean, there's a number of things that drive to clinician burnout. So technology is a piece of it, but obviously the reimbursement changes over the years, the expectations, organizations trying to be more lean because they almost have to survive from a nursing perspective, and things make a huge impact. And my wife's a nurse, so I know, the day-to-day of everything that happens from that perspective too. And you can't always do more with less. Technology doesn't plug that gap. EHRs don't necessarily plug that gap. So this was an article recently in the last couple of days, I think, about poor EHR usability linked to nurse burnout and patient mortality in the study. So nurses are blaming the usability of EHRs, and they had a ranking of or scoring system of EHRs, and so for those they say didn't do a good job of developing the EHR and good implementation of it, that leads to nurse burnout. Well, I guess it makes sense. I think a good implementation can lead to nurse burnout too of an EHR. The problem with all these studies, I think, is that you never really hear the flip side of what you do. Like, you're delivering data that's necessary at the point of care when it's needed, things like that can help drive decisions. So we all get that. And I think long-term, hopefully quality improves and everything. But the interesting thing about this was it was a 12,000 nurse study on EHR usability and outcomes. And then they were able to go back and look at mortality data for those organizations who ranked it low, and saw that the mortality was higher in those. And to me, that's compelling, scary and compelling at the same.
Yeah, so I always come about this in two ways. So we covered, nurses gave the EHR usability an F grade last week on the show. So if anyone's interested in that, but there's almost a follow-on to that.
Mhm.
The usability is so important. The data is even more important. Well, I mean, the EHR can lead to adverse events. That's a nice way of saying the EHR can kill people.
Right.
I mean, if there's incorrect information in there and people are acting on that incorrect information, there's a lot of checks and balances, and there should be. But if there's incorrect information in there, it can lead to an adverse event. Doesn't have to be a death, but it can lead to a lot of adverse events.